This video shows fetal demise in ovarian pregnancy. Ovarian pregnancy refers to an ectopic pregnancy that is located in the ovary. Typically, the egg cell is not released or picked up at ovulation but fertilized within the ovary where the pregnancy implants. Such a pregnancy usually does not proceed past the first 4 weeks of pregnancy. The pouch of Douglas, cul-de-sac or rectovaginal septum, is the space between the rectum and the uterus. This is the lowest part of the abdominal cavity. The female pelvis is a complex and ever changing area of the human body. And the pouch of Douglas is a particular area of contrast, also known as the cul-de-sac. The pouch of Douglas exists between the uterus and the rectum and is the most dependent area of the pelvis where fluids pool. A small amount of fluid in the cul-de-sac is normal and is usually not of concern if the fluid sample shows signs of pus or blood. The area may need to be drained. Sometimes blood can be result of the ruptured cyst or sign of an ectopic pregnancy. Just 1-2% of all pregnancies are ectopic, and in 95% of those cases the egg fertilized in the fallopian tubes on its way to the uterus. In 0.5% of cases, including this one, the baby grows inside the ovary. Ectopic pregnancy is the implantation of the conception. The patient may present with sign of shock with an ectopic. No evidence of intrauterine pregnancy would be noted on ultrasonography. Conceptus denotes the embryo and its adnexa, appendage or adjunct parts or associated membranes, that is the products of conception. The conceptus includes all structure that develop from the zygote, both embryonic and extra-embryonic. Ectopic pregnancy is the implantation of a fertilized egg in an abnormal location. In an ectopic pregnancy, the fetus cannot survive. When an ectopic pregnancy ruptures, women often have abdominal pain and vaginal bleeding, which, if not treated, can be fatal. If the fertilized egg continues to grow in the fallopian tube, it can cause the tube to rupture, heavy bleeding inside the abdomen follows. Usually, symptoms of this life-threatening event include extreme lightheadedness, fainting, severe abdominal pain, and shock. Most ectopic pregnancies can be detected using a pelvic exam, ultrasound, and blood tests. A pregnancy in the uterus is visible 6 weeks after the last menstruation period, but with an advanced ultrasound machine, it could be seen earlier. Ectopic pregnancy should be suspected if there are no signs of an embryo or fetus in the uterus as expected, but HCG level are elevated or rising. An HCG level of less than 5 ml